I'm Dr. Lenore Coleman, president and founder of Healing Our Village, and I just want to welcome you all to our Sugar Buster series. We do this on Saturdays from 11 to 12, and I want to thank all of you all who are out there, all of my patients that are in doctor's offices that are working with Healing Our Village, as well as all of my Facebook friends and family that have been tuning in to Healing Our Village on our Facebook page. Listen, we got to have you go to HOVHealth.com. We want you to look at all of our videos that we have on demand. Please like us on Facebook, like us on Instagram, and I want you all to start having a watch party. We're doing this on Saturdays 11 to 12. We would love you to have all your friends, your family, everyone who may have diabetes, may have hypertension, may have high cholesterol. We need them to be tuning in to Sugar Busters on Saturdays. So again, welcome. Today we're going to be talking about cholesterol. This is segment 5 of our Sugar Buster series. There's actually 7 segments. So we repeat them once we get through segment 7. And so then we just repeat again so you can never miss anything. And again, all of the episodes are posted up on our website, HOVHealth.com. If you have questions, if you want to get your own private dietitian, your own private pharmacist, if you want a concierge service, then you need to come to our website and join Village Club, $5 a month. And we will be sure that you have all everything available to you, all the services to get your blood pressure and your blood sugar under good control. So today, we're going to talk about cholesterol because cholesterol is so important. Many of the people who have type 2 diabetes also have high cholesterol. In fact, many of the people who have elevated cholesterol and diabetes are all taking, or should be all taking, a medication from a class of medications called statins. So we have people who are on rosuvastatin or lovastatin, atorvastatin. All of these are drugs that if you have diabetes and if you have high cholesterol, the data shows that you should be taking one of those medications because not only do they lower your cholesterol, but they also help with other mechanisms in the body that are important to decreasing your risk for heart attack and stroke. So people talk to me all the time. They ask me, Dr. Coleman, I'm on a cholesterol medication. And I say, well, you know what cholesterol is? And they say, no, I don't really know. So let's talk about exactly what is cholesterol. Well, cholesterol is a waxy substance. It's basically like a fat in the blood. And the body actually needs cholesterol. You need cholesterol to help your brain to function, to help certain processes in your body need cholesterol. So you can't eliminate cholesterol from your diet. You still need to get some cholesterol. And we get cholesterol from the foods we eat, but you need to know that your body just naturally makes cholesterol. And so when you're talking about lowering your cholesterol, it's not all about what you're eating. There are some people that can totally eliminate cholesterol from their diet, but still they have high cholesterol levels. It's called familial hypercholesterolemia. So it's a genetic situation. It runs in families. And so even though we do need to be cognizant of the foods that we're eating and try to lower our cholesterol intake, in some patients, that doesn't even do the trick. They have to be on medications no matter what they eat. Now, why do we care? Why do I care? I care because we know that people that have high cholesterol also tend to be at risk of cardiovascular disease. So we know that there are persons that die every 36 seconds in the United States from cardiovascular disease. There's about 655,000 Americans that die from heart disease every year. That's 1 in every 4 deaths in this country is because of cardiovascular disease. We actually are the leaders in the world of cardiovascular disease. There are many, many countries where they just don't have that many people dying from heart attacks and strokes. So this is really an American problem. We know that heart disease cost the United States about $219 billion from the years 2014 to 2015, so that number is even higher now. And when you look at the cost of a certain disease state, you got to take in consideration the lost productivity from work, because they're either sick or they've died, healthcare services, medications that they're on. All of that is part of this cost of a certain disease state. So that 219 billion is even higher, as I said, now, because we're in 2021. Now, when you talk about cardiovascular disease, there's different sort of types of cardiovascular disease. When you're talking about cholesterol, you're talking about coronary artery disease, because it's the cholesterol that clogs up the arteries in your body, leaving the heart, and that is what is causing the heart attacks and strokes. So the coronary heart disease is the most common type of heart disease. It kills about 365,000 people, give or take, in 2017. So again, that number is even higher. There's about 18.2 million adults aged 20 or older that have coronary artery disease. And when you think about the death rate again, 2 in 10 deaths from coronary artery disease happen in adults that are less than 65 years old. Now, heart attacks. In the United States, someone has a heart attack every 40 seconds. Every year, we're looking at 805,000 people having heart attacks. 605,000 are having the first heart attack. 200,000 happen to people who have already had a heart attack. So 1 in 5 heart attacks are actually silent heart attacks. So they don't even know that damage is being done to their heart. Now, let's talk a little bit about why it's important that we keep that cholesterol level down. Too much cholesterol in the blood builds up on the inside of your arteries. By that buildup happening, your heart now has to work harder to push the blood through the arteries. This can mean a stroke if the blood cannot get to the brain, or a heart attack if the blood cannot get to the heart. So this is a really nice picture of what that looks like when you have the plaque building up in your arteries. Now, when you talk about heart disease, there's sort of a collection, and that's coronary heart disease, which is the most common, coronary artery disease, which is, we abbreviate as CAD, and then there's peripheral vascular disease, which is PVD. And this is the most common cause of narrowing or blockage in the heart. Now, here's your normal artery. And you can see that on that top picture that it's a nice open artery. It doesn't have any collection of fat on it. And then you see that lower picture, and you see all of that white or yellowish substance collecting on the inside of the artery. Well, that is plaque, or the cholesterol. Cholesterol turns into basically this plaque. And so you see now it's a narrower opening. And so it's harder for that blood to get through that narrower opening. Now, what are the risk factors for heart disease? Well, high cholesterol, smoking, high blood pressure, diabetes. These are all conditions that are risk factors for heart disease. Behavioral situations like smoking, diet, excess alcohol, lack of exercise, being overweight or obese, and being high stress. These are all behavioral lifestyle things that are risk factors for heart disease. And then I mentioned family history. Sometimes you have high cholesterol levels that run in families, so it's genetic. But as you get older, as you age, that can be a risk factor, and also being a male is a risk factor for having heart disease. Now, when you talk about cholesterol, you're talking about bad cholesterol and good cholesterol. So when you're going to the doctor and they're taking that blood test and they're running what they call a lipid panel, there are multiple components of that lipid panel. All right? There's something called low density lipoprotein, or LDL. That's your bad cholesterol. There's high density lipoprotein, HDL. That's your good cholesterol. It's good because that HDL is what gets the LDL out of the bloodstream, out of your body. That's a good thing. So it's the high HDL. If your HDL is high, if you have high numbers of the HDL lipoprotein, that will help decrease the numbers of your low density lipoprotein. All right, so the LDL, the low density lipoprotein, is what usually causes the buildup in your arteries, whereas your HDL absorbs the cholesterol and carries it back to the liver, where then it's flushed out of the body. So the bad cholesterol raises your risk of heart attack, and your good cholesterol lowers your risk of heart attack. Now, how do we measure it? As I mentioned, you do a lipid panel, you do a blood test. And in that blood test, you're going to have your LDL, your bad cholesterol, you're going to have your HDL, your good cholesterol, you're going to have your total cholesterol number, and you're going to have your triglycerides. All of those are on that lipid panel, and all of those are very important, especially in people who have diabetes, because we want to make sure that if you have diabetes, that your cholesterol level is actually less than 100. We really want to be very well controlled in terms of getting your cholesterol level down. People with diabetes tend to have high triglycerides. So triglycerides can become very important in people with diabetes, and so they may need to take a couple of medications in order to be able to bring down both their LDL and their triglyceride levels, because a lot of the drugs that lower your LDL don't do a very good job with lowering your triglycerides. So here is the test. Here are the numbers. And so when we're looking at what the numbers should be, we want that total cholesterol to be below 200, your triglycerides to be below 150, we want your LDL to be below 100, and we'd like your HDL to be above 60. So those are the numbers that we usually shoot for, and that as a pharmacist, this is what I'm monitoring to see if the medications need to be increased or modified in order to be able to get those numbers where they need it to be. Now, we know that, again, LDL cholesterol contributes to the buildup of fat. It decreases the blood flow, and you can lower that LDL cholesterol by diet, exercise, and by taking your cholesterol medications. Now, the good cholesterol, the happy cholesterol, the higher the better. How can I raise my good cholesterol? Well, I can do that through exercise, by taking my medications, and also by eating properly and decreasing a lot of the saturated fats in my diet. Now, let's talk a little bit about triglycerides. It's a common type of fat in the body. It comes mostly from diet, and things that increase triglycerides are beer, for instance, certain pastries and cakes and sweets, right? Just kind of hanging out and watching TV all the time. And things that we don't want to do, like smoking, getting overweight, all of those are things that can increase your triglycerides. So we're going to take a short break right now. I always like just to allow you guys to get up and stretch a little bit, go get a glass of water, and we'll be coming back to you to talk about what levels of cholesterol are good.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol and organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Okay, well, welcome back. Thank you so much. I hope you enjoyed that little commercial break. I just wanted to say one more time that it is so important to get that LDL cholesterol less than 100. That's your number. And, you know, here at Healing Our Village, we're really focusing on you knowing your numbers. So your A1C needs to be as close to 7% as possible. Your blood pressure needs to be 130/80 or less. And your cholesterol number, the number I need you to focus on, is that LDL or lousy cholesterol, and it needs to be less than 100. Now, things I can do to change it. We talked about what eating, physical activity, controlling your weight. But the things we cannot change is getting older. We can't change that. We can't change gender necessarily, and family history. You can't pick your parents. So some of you have cholesterol in your family. It's genetic, and there's nothing that we can do about that. But that's a very small proportion of the population. Most of the people who have high cholesterol is because of what we're eating and not getting enough physical activity. So again, diet, physical activity, weight loss, they're very important, but also taking your medications is very important. So there are a number of medications that can be used to lower your cholesterol levels, to lower your triglyceride levels, to increase your happy cholesterol, your HDL cholesterol. And so when those doctors prescribe those medications, especially for you out there who have diabetes, you have to take the medication. Many people don't take it because, you know, cholesterol doesn't hurt. You know, people take their pain medications. Or if you have the flu or you're sick, you take that because you're feeling bad. All right, but you won't even necessarily know that your cholesterol is high. So we really encourage you to take those cholesterol medicines. What we found is that most people, 50% of people exactly, stop taking their medications after a year. So you start taking them, you're doing good, and then after you've been on your cholesterol medications for a year, then you start forgetting to take them every day, or you just stop taking them. We want you to eat foods that are not high in saturated fat. We want you to avoid foods with trans fat. We want you to eat more fiber types of foods. So those are your apples, your pears. These are your kidney beans. Oatmeal. You always hear people talk about, oh, I eat oatmeal in the morning to help my cholesterol. So foods that have grains, so breads that are like wheat bread or brown rice, those are high in fiber. Those tend to not only fill you up, but they're good in terms of decreasing your cholesterol levels, or at least not increasing your cholesterol levels. Also, when you're thinking about oils to cook with, olive oil and canola oil, using the skinless chicken or turkey, lean beef, veal, pork chops, lamb chops, trying to eat more fish. They recommend that you try to eat 10 to 20 fish meals per week. Using the egg whites instead of the egg yolks, making sure that if you're going to be eating any kind of frozen yogurt or ice cream, that you definitely need to make sure it's low fat, Okay, for those folks that have diabetes, we really want you to not focus on the ice cream unless you're getting sugar-free ice cream, and then of course that's fine. We know walnuts and almonds are good. All right. We know not to eat your coconut oil, your palm oil, butter, lard. Don't use that to cook with. Processed or fatty meats. Again, the egg yolks are high in cholesterol. Your cream cheeses, ice cream, all of that, we ask you to avoid those as much as possible. Potato chips, and then fast foods. Fast foods are something that we need to really move away from. You can have them every once in a while, but really, by and large, you need to be eating fresh foods as much as possible. Exercise is critical. I am now walking around my neighborhood. I try to do it every day. I'm probably getting it in about 4 times a week, and that's just reality because of my busy schedule, so I understand. But I tell you, I used to do no times a week. So 4 times a week is good, and I'm trying to get that up to 5 times a week. So activity is really important for people who have high cholesterol or for people who are obese or overweight. There's the tape measure test. If you want to know if you're overweight and you need to lose some weight, you can just measure your waistline, right? And then men, if your waistline is larger than 40 inches, and women, if your waistline is larger than 35 inches, then that means you got a problem. So you got to start cutting your portions, eating healthy, trying to decrease your weight, and you can do that by getting more exercise every day. It's your 10,000 steps, 150 minutes of exercise per week is what we're shooting for. We know that physical activity is very good because it helps you lose weight, but it also raises your good cholesterol. And remember, it's the good cholesterol that removes the bad cholesterol to the liver and then out of the body. So, question, how much weight do people need to lose to start lowering their cholesterol? And the answer to that question is about 5 to 10% of your body weight. That's where we want you to start. Start by losing 5 to 10% of your body weight. And what I tell people all the time is if what you can do today to start changing your course of eating and losing weight, stop drinking your calories. Look at whatever you're drinking, and it should be 0 to 5 calories, no more than that. If it's more than 5 calories, don't drink it. Because you should be eating your calories, not drinking your calories. Again, being overweight, you need to try to decrease that weight because it increases heart disease, increases cholesterol. Losing weight lowers your bad cholesterol and raises your good cholesterol. Again, eat 500 fewer calories every day. That's your goal. 3,500 calories less a week will give you 1 pound a week. So you do that in 500 calorie increments. So eating 500 fewer calories every day or burning 500 more calories every day is how you get to that 1 to 2 pound weight loss per week. The medication, I mentioned the statins. Most people with diabetes are taking a statin. It lowers the bad cholesterol and it slows down how quickly the liver makes cholesterol, and it helps it remove the LDL from the blood. Statins don't cure high cholesterol, but they'll keep that number down so it decreases your risk of heart attacks and strokes. So you got to take your medications. You got to take it every day. Sometimes the statins can cause some leg pain, some muscle aches. So if you're experiencing any side effects that you're don't remember having before, that's a conversation that you need to have with your doctor. Ask your pharmacist. They're very good and very knowledgeable about medication side effects. So if you're feeling something that you don't remember feeling before, check in and make sure that because we can change your cholesterol medicine so that you can tolerate it. When you're talking about the various medicines, we'll just really quickly go through those. You have your bile acid binders. They usually are powders that you mix with water or juice or food. These, because they are a binder, you should space them from your other medications. A major side effect is constipation, and the names of the medicine are there: Questran, Colestid, and Welchol. You have your niacin. It's been around a long time, nicotinic acid. I really like this drug because it not only decreases your LDL, but it increases your triglycerides and your HDL. So basically, it's just a vitamin B3. It does cause flushing. Sometimes some people have some itching. Should be taken with food. And these products can be purchased over the counter. Here are some of the brand name products, but now niacin's available at any pharmacy or health food store. Fibric acid, these basically can sometimes increase your bad cholesterol slightly, but they are really good at decreasing your HDL decreasing your triglycerides. So the interesting thing about decreasing your triglycerides is if when your triglycerides go down, your HDL goes up. So there's a reciprocal relationship between triglycerides and HDL. So the fibric acid medications are out there. That's your gemfibrozil or your phenylfibrate. They can cause some of the constipation, the nausea, may also, again, cause muscle weakness or muscle pain. So again, if you're having any of these potential side effects, you need to talk to your pharmacist and your physician so that they can make recommendations the pharmacist can make recommendations for maybe a different medication for your doctor to use. Zetia is another medication, is a cholesterol absorption inhibitor. It does not have to be taken with food. It actually can be used with a statin. So a lot of times there's actually some combination drugs that are out there that have both the statin and Zetia inside the tablet. Side effects are headache, abdominal pain, and diarrhea, but they also do a very good job at decreasing your bad cholesterol. Fish oils are available, again, over the counter. That's your omega-3 fatty acid supplements. They are over the counter. They're not necessarily FDA approved for cholesterol lowering, but there is some good data that shows that they are able to do that, and they're somewhat inexpensive. I would rather see you eat more fish in your diet. Again, I'm really into eating more naturally, using foods as opposed to medications if you possibly can. Here are some of the combination medications that are available. Probably the most commonly used used to be Vytorin, but there are other combos on the market. And that is our segment on cholesterol. We want to thank you for tuning in. Remember, Sugar Busters every Saturday, 11 to 12, streaming live. Set up a watch party. Tell all your friends, tell all your family. If you need specialized help, give us a call, Hailing Our Village, 800-788-0941. Go to our website, HOVhealth.com. Look at video on demand. All of our Sugar Busters series is there for you to watch. And we also have our nonprofit, Total Lifestyle Change. If you want to support what we're trying to do to heal the village, please, we ask you to go to tlc-global.org and donate what you can. Thank you so much, and we look forward to seeing you next week.